In this segment, I would like to talk about the surgery upper blepharoplasty. So when I'm evaluating the upper face, I look at the forehead, the brow position, and then the status of the upper eyelid skin. Once I've ruled out that there's no brow contribution and that someone has extra upper eyelid skin, then they're a candidate for an upper blepharoplasty. So an upper blepharoplasty is a pretty straightforward procedure where basically I'm removing skin of the upper eyelid. In some patients, I may also be smoothing down a fat pad, but most commonly it's just removing the excess skin that has started to hang or sag over time. If this procedure is done in an isolated setting, meaning it's no other surgeries are done at the same time, then it's pretty straightforward in that we do it under a very light sedation. In our office, this is usually an oral sedation, and that's where we give you a few different medications, a medication to relax you and a pain pill that makes you very comfortable, very relaxed. Once that medicine has kicked in, which usually takes about an hour, we'll move you over to the operative area. And at that point, I will precisely measure exactly what skin we're removing and then inject you with numbing medicine. The numbing medicine is stimulating. It's lidocaine, which most people have had that in before, but it does sting a little bit going in. But again, that oral sedation makes you very comfortable for that part of the procedure. Once you are numb, you should not feel any pain. You may feel a little bit of pressure, a little bit of pulling, but you shouldn't feel any pain. And because of the oral sedation we give you, usually you're very relaxed. The procedure itself is pretty quick. Typically, per eye, it takes anywhere from 20 to 25 minutes per side. With that procedure, I will go in and remove the extra skin, again, potentially remove some fat, and then close the incision. The incision falls really well in your natural eyelid crease. However, some of the incision comes out a little bit beyond the crease, which we typically blend into one of your natural smile lines, and that just helps to get the extra skin over here. Right away, we'll put some ice on your eyelids right afterwards, move you into the recovery area where we'll give you a little light snack, and then go over aftercare instructions with your ride.